The following program is sponsored by Memorial Healthcare System.
We're moving health forward with Memorial Healthcare System. Sports medicine. It's not only for elite athletes.
Sports medicine really involves anybody who wants to get back into their best possible physical activity.
From fitness enthusiasts and weekend warriors to tactical athletes in physically demanding professions, sports medicine can get you back to your sport and back to your life. How exercise of any kind affects the heart.
I felt something funny in my heart. I felt palpitations.
And advances in hip and knee joint replacement.
When you wake up in the morning and you're not in pain, it's sort of a miracle, that's for sure.
For quality of life at any age. Welcome to Moving Health Forward with Memorial Healthcare System. Whether you're a weekend warrior, an elite athlete, or anything in between, everyone who practices fitness and sports is also at risk for injury.
Many of my patients routinely engage in exercise, whether it's interval exercise or cycling, marathons, playing in various sports leagues for recreation. Weekend warriors are extremely prevalent. And these are people that just like to get after it. They like to get out there and be active. So maybe Monday through Friday, they have their normal work routine, but on the weekend, they really like to engage in those activities. And a lot of times those activities can put a great strain on the body.
Even though we are called the Memorial Sports Medicine Center, it's not reserved specifically for professional athletes. Sports medicine really involves anybody who wants to get back into their best possible physical activity.
I've had parents that have new children, and as those children get larger and larger, they develop different tendon issues, tendonitis. The truth is, we tend to treat them with a similar sense of urgency. They're getting the same level of care that we give our collegiate level athletes and professional athletes. Dr. Lemus Ramirez came to me with a chronic ACL injury. He knew his diagnosis, but he just had not had the time due to the rigors of his profession to take the time to treat it. He plays in a very highly competitive kind of physician World Cup. He was very adamant about having the opportunity to return to that. One of the issues that he faced, not only with soccer, with just his everyday life, kind of always having that in the back of your mind that the knee could buckle, could give out at any time.
I have two little kids. By that time, my oldest one was 3 years old, so pretty active. So every time that she wants to start running or playing around, was a little bit difficult because my knee get locked.
So we put together a treatment plan. We expedited his imaging and his surgery, and working in conjunction with physical therapy, which did a tremendous job in really returning him back to the same level of play that he was accustomed to. And he was actually able to compete in that soccer tournament as scheduled.
The tournament was amazing, one of the best experiences in my life.
We're excited for him to see him make that recovery.
Memorial has a world-class rehabilitation institute, and we definitely leverage that to our advantage. The physical therapists we have are very subspecialty focused. We have some that specialize in trauma recovery, some that specialize in sports medicine, as well as joint replacement.
Currently, the Memorial Sports Medicine Center serves as the sports medicine providers for Broward College, ASA College, and Florida Memorial University. All of our physicians serve as team doctors. We offer pre-participation physicals to the universities that we cover. Essentially, we're just making sure that all of the athletes' medical records are up to date. And if they've had any injuries over the summer, our doctors are aware before they clear them for the next sports year.
We also have a very strong team of athletic trainers that we work with. They help identify injuries, and they also are out there in the field at a lot of the events that we cover. We really understand how important a patient's sport or athletic activity really helps them identify with themselves and feel whole. Our first goal is to get them back 100% to their pre-injury status, or as close to that as possible. We try to set realistic expectations, but we really are swinging for the fences for all of our patients.
Ask the doctor. How can South Floridians beat the heat when it comes to exercise?
The majority of the time here in South Florida, it is much hotter than the rest of the United States, and heat can pose its own risks during sports participation outside, specifically endurance-based sports. I think it's really important to understand what days are hotter than others, and when those days happen, we should take more hydration breaks, we should have access to shade, and maybe we shouldn't push ourselves on those really hot days.
Every day, firefighters, police, and EMTs are pushed to the limit in physically demanding jobs. And like elite athletes, these tactical athletes are super motivated to get back to work, fully functioning at their highest level as soon as possible.
One of the more demanding patients, or in terms of their function in their professions, are these what we call tactical athletes. This applies to first responders such as police, EMS professionals, firefighters.
They have jobs that require very strenuous type activities. Running, jumping, rolling, tackling, that is somewhat similar to what athletes have to go through when they participate in contact type sports.
The severity of the injuries could be even higher because they are involved in car accidents and major falls, so the potential for them to have major injuries, broken bones, maybe even more so than a professional athlete.
My name is Officer Gibbons from the Hollywood Police Department. My daily job entails traffic enforcement in the city of Hollywood. We ride a 2016 Harley-Davidson Electra Glide. It's an extremely heavy bike. You know, it's a demanding job to ride a motorcycle.
For a tactical athlete, they have to be performing at their optimal performance. If they get injured or their physical ability is compromised, then it can be devastating.
Early November of last year, I was riding on our police motorcycle course, and the bike actually came out from underneath me. The bike fell onto my left ankle. I not only dislocated my ankle, but I also had a large fracture in the back of my ankle bone. When I first saw it and my ankle was sideways, I thought, there goes my motorcycle career, it's over. I'll never ride a motorcycle again.
He had an acute injury, and we were able to treat him same day.
The surgery went amazing, actually. And he wanted to make sure that I was as perfect as he could make it, because he knew how important it was for me to go back to police work and being on a police motorcycle. And he looked at me and said, you will be back on the bike in 6 months. And I can sit here and tell you that he was right.
He was able to heal, and through working with physical therapy, he got his strength, his range of motion back, which is actually critical for him riding a motorcycle to have that dexterity and proprioception as it relates to his ankle.
Just like a football player wants to get back into the game, these tactical athletes want to be able to get back to their jobs and protect us as a society.
While they may have the same fracture, the same ligament tear, and we treat them surgically probably the exact same, they require a more robust physical therapy program to get them back to that elite shape where they can be lifting heavy weights, where they can be doing their duties. And we do have a special tactical athlete program here at Memorial specifically catered to those high demand individuals.
The firefighters, the ambulance workers, the paramedics, I mean, those guys they're excited to get back to doing their job. It's a pleasure treating them because they're highly motivated individuals, and they're extremely good patients because they want to do well, they want to follow directions, they want to get back to normal. So, you know, it's important, their expectations are high, and you're there to deliver for them, to get them back on track.
To know that I get to go back to doing what I love so much, to get back on my motorcycle, to get to help the citizens out. You know, that was a dream come true to me again. You know, to get back to where I belonged. That was what I wanted to be. That's where I ended up.
Did you know? For adults, the American Heart Association recommends 150 minutes per week of moderate intensity aerobic activity. We've all heard exercise is good for the heart, but depending on your level of fitness and sports participation, we learned that all hearts are not the same.
Sports and fitness are good for the heart in every single way. We know the more exercise and the more activity someone does, the better off they will be, both in terms of how long they will live and how well that they live as well. Sports cardiology is the care of anybody who really wants to be active. Now, that can encompass anybody from a weekend warrior all the way through to a professional or Olympic level athlete. And we know that this is a population which is very different in the world of cardiology. The way in which they behave, the way in which their testing looks, the way in which we treat them is very different than the general cardiac population.
Pretty much my whole life, exercising has been a big part of my life and what I love to do as well.
Carlos is really interesting. Carlos has been exercising, multi-sport athlete for a long period in time.
I was exercising in the gym and I felt something funny in my heart. I felt palpitations. So feeling those palpitations got me a little worried and I decided to go to the hospital to see what it was. Every cardiologist kept telling me a different story until I actually saw Dr. Friedman at Memorial Healthcare.
We have a very sophisticated algorithm for triaging patients to make sure that they go to the right physician as soon as possible without having to bounce around different doctors.
Before I saw Dr. Friedman, I wasn't exercising about for a year and a half because I was scared. I was just stay home, had anxiety, had depression.
We were able to put him through multimodality testing. We were able to have him exercise in front of us, and we were able to see that the changes in his heart were actually due to the exercise that he had exposed it to or exercise-induced cardiac remodeling, and that this was completely normal for Carlos. This is how his heart has changed, much like a bicep muscle would change to weightlifting. We told Carlos to keep exercising and to have at it.
When he assured me that, and I started slowly getting my confidence back, started exercising, making me feel better, happy, not having no anxiety, no depression. Pretty much my normal self before I had this issue with my heart.
Exercise is a very important thing to me, and if somebody took that away from me, I can't imagine how I would feel. The greatest reward I have is getting somebody back doing what they love as quickly as possible.
Great workout.
I think the differentiating factors for our Memorial Sports Medicine Center is that a majority of the physicians on staff here are either former or current athletes themselves, so they know what it's like to suffer an injury and then the hard work it takes to get back to a competitive form. And secondly, it truly is the comprehensive and multi-specialty focus that encompasses every single specialty an athlete would need to make a full recovery.
We're all athletes. How do you think that impacts how we approach our jobs, how we treat athletes, how we take care of people?
My experience as an athlete definitely weighs in. Some of the injuries that our patients come in with, either I have had or I've had teammates that have experienced those things and have gone through the recovery of that. Also understanding the urgency of returning back and getting back to the same level. Not just, okay, I'm not hurting anymore, but can I do what I once was able to do on the same level?
Absolutely. I think athletes are super motivated. They want to get back. They're impatient. They have a timetable to which to get back to their normal activity level. So I think being athletes ourselves, I think it helps kind of understand that.
We really are a multidisciplinary team, so it's weird for a nerd to run with the jocks like you guys, so to be a cardiologist hanging out with a bunch of orthopedic surgeons. But in addition to that, we have non-surgical sports medicine, we have physical therapists, athletic trainers, and we're constantly talking to one another, right? So everybody's always in, and it really is this large team that's helping to take care of athletes.
I love when patients I ask them, who's your cardiologist? And they're like, oh, Eli Friedman. And I said, okay, I'll reach out to him. You just pick up the phone and call.
Absolutely. Like, the team approach is quintessential to our program. And I think we really adopt that on every level. We're always all learning. We're always all trying to get better. And that really speaks to being a forever athlete and kind of carrying that mentality.
How do you think we can make the community healthier and more active and really keep everybody sort of moving forward in their lives from an athletic standpoint?
We do talks, we do presentations, from basic topics to more advanced topics, whether it's orthopedics or cardiology, talks to the local law enforcement and ambulance workers or anybody who's active, really. It's about injuries prevention and just educate them.
As your orthopedic sports medicine population continues to age, what do you guys see as people exercise for longer periods of time and for higher intensities?
I think preventative medicine, really understanding, what an overuse injury is, what are some of the prehab things they can do to protect themselves from, sustaining a rotator cuff injury or overuse, knee injury. And I always tell patients, you know, this important posture training, things that we sort of take for granted, certain things that are going to take some pressure off of the rotator cuffs as we get older.
You speak to preventative medicine. If they come in, say, for example, with a right shoulder injury, well, do these exercises to help on your right side, but also do them on your left to prevent an injury that could potentially occur in the future.
And preventative from our standpoint in the sports cardiology world really comes from, number one, knowing what your family history is. So anybody who wants to exercise and wants to do so at high levels should certainly know, is there a family history of heart disease, blood pressure, cholesterol? And then we always tell people, listen to their body, because if you don't listen to your body and you push through something, that's when bad things happen.
And generally, this population tends to push through things, whereas from a medical standpoint, that may not always be the right answer, but we want to be able to kind of really, you know, define what is safe for them and maximize what they are able to do.
What are you guys excited about? Where's orthopedic surgery and sports medicine heading?
A lot of what we do is arthroscopic surgery, so I think implants are getting better, our instruments are getting better, there's more nanotechnology, you know, the cameras are getting smaller. The ways we can get inside the shoulder or the knee or the hip is a lot slicker, a lot easier, and so we're causing less trauma to the shoulder, or the knee, or the hip, and so the recovery is a little faster.
What I'm most excited about, what we're able to provide for the community, is that high-level, kind of first-class, multidisciplinary approach to sports medicine. We do a lot of events that are fun, and some of them seem cool and flashy, but at the end of the day, a lot of what we do, some of it even behind the scenes that doesn't get publicized, really at the root is patient engagement and patient information.
We're people who are vested in this field. We're not just saying this and not practicing it. We're out there, we're doing this, and it's an important part of our lives. I think that enables us to have a really special relationship with the people who come to us seeking help.
Absolutely.
Ask the doctor. If I get a hip replacement in my 50s, will I have to replace it again in my lifetime?
For patients 54 years of age and older, with a well-done hip replacement with modern bearings, meaning either a ceramic ball or a metal ball on highly cross-linked polyethylene, that will probably not ever wear out. Now, it may fail for other reasons like fracture, infection. There are other ways that hip replacements fail. But it won't fail because you wear it out like you wear the brake pads on your car.
We used to think of hip replacement as surgery for the elderly, and as the boomer generation reaches their senior years, experts say this silver tsunami will put an all-time high demand on the healthcare industry. Still, more and more people are opting for hip replacement surgery in their 40s, 50s, and 60s. It's all about quality of life.
I was in pain for over 2 years. I could not put my socks on, I could not put my shoes on, I couldn't bend.
The indication for hip replacement is someone that has advanced arthritis, that has significant pain, and that has failed non-operative treatment. And that can happen whether you're 40 years old or whether you're 80 years old. I think that I saw Vincent first, and then I saw Sally. When I saw Vincent, he was very debilitated. He could barely walk.
I was using a walker for about 12 years. And I'm a big chicken. Finally got to the point where it got so bad, my wife was very adamant that I needed to get it done.
Joint replacement, which is also known as joint arthroplasty, comes from the Latin term arthroplasty, which means a reforming of the joint. Basically, we take patients that have arthritic joints and we reconstitute them with metal, plastic, and ceramic implants to give them back their function in their life. The average age of hip replacement when it was first established in the 60s and 70s was about 75 years of age. Nowadays, the average age for hip replacement is about 65 years old. So we're doing hip replacements in younger patients.
My name is Aviva. I don't know if I should say my age, but I'm 48. It probably started a good few years ago. It was just kind of the wear and tear and just arthritis. Finally, it just got to a point where it was so painful. I could have been suspended like in midair and it still would hurt.
The way I phrase this with many of my patients is, as you're younger now in your 40s, should we fix your hip, give you back your quality of life, and then be pain-free in the years in your lifespan where you're most active? It was an easy decision.
I needed that now. I needed to feel good now.
We've worked very hard over the last several years to develop the Memorial Joint Replacement Center and incorporate all the different disciplines that really touch the patient.
We want you to know about pain management.
The class at the hospital was extremely important and informational, and the people at the hospital are wonderful. They answer everything, and you meet everyone that works on the floor.
Education for any joint replacement patient is paramount. We've been very successful in keeping our length of stay under 2 days. So it's imperative for our patients to understand how to prevent any kind of complications, and if any complications arise, what to do about it. It's also very important for them to know what their post-op milestones are.
Anterior approach hip surgery is less disruptive to the muscles around the hip. We go through a natural interval in the front of the hip to actually move those muscles out of the way. Sally was the brave one. She had surgery first. She had an anterior approach hip replacement. Many patients that have anterior approach surgery really get up quicker, have less pain, and have a more normalized gait.
I had no pain, 0 pain.
She was up and going in no time. As a matter of fact, once she did her surgery, she convinced Vincent to make sure that he did his. I still do the posterior approach for selected patients. Vincent had 2 posterior approaches, and Vincent's outcome was really the most remarkable. When I finally saw him at 6 weeks after his last operation, he actually walked in. It was the first time we ever saw him without a walker, and he was walking normally. And we really gave him their life back.
I woke up from the anesthesia, very bright and alert, and literally later that evening, I was already sitting in a chair, walking to the bathroom, myself.
We work with very closely our rehab physical therapists who ensure that these patients are up and out of bed, ambulating, as well as providing them comfort measures, being given the fact that they've just had a replacement surgery. Quarter to quarter, year to year, our patients, they stay on this unit on average of 2 days. We get them onto their next steps, and I see many of them come back weeks later without their walker, without their cane, and they tell me the stories. I've gone back to going skiing. I've been speed walking again, and just story after story of these folks being able to regain their life.
I love putting my shoes in socks.
She has enough of them.
Oh.
Dr. Isla kept telling me, you'll see it's going to be life-altering or life-changing, and I said, yeah, and he was 100% correct.
When you wake up in the morning and you're not in pain, just to see him, just out there mowing the lawn and feeling great. And it's short of a miracle, that's for sure.
Did you know the U.S. Census Bureau projects that by the year 2030, older people will outnumber children for the first time in U.S. history? Another quality of life procedure, knee replacement, has come a long way in helping patients get back to their lives pain-free.
When you're walking and you're in pain, there's nothing like it. It's like a grinding pain.
This is a similar theme that I see in people with severe arthritis. She had progressively worsening pain in her knee. This steadily limited her activity to the point that she could walk only about 2 blocks. She had difficulty with bending, difficulty with stairs, and difficulty sleeping.
There's nothing to ease that pain. I took medication, I was on anti-inflammatories, I did whatever I could, but it just didn't stop.
Knee replacement surgery is becoming increasingly common, especially as people are getting more active and staying more active throughout their adult lives and as we're living longer. Right now, we're doing about close to 300 knee replacements a year.
I'm an active person, I work full-time, I run 2 medical offices, and I need to be able to go when I need to go.
Basically, what it comes down to is that when your knee is hurting and your quality of life is impacted, you want to get back to those activities. It used to be that we would shy away from doing people at 50 years old or 55 years old, but you'd rather have those 15 years from 55 to 70 with a good quality of life where you can still work and function as opposed to having to steadily decrease your quality of life.
I was teaching spin classes about 3 days a week, so that's about three plus hours, and then there's the training to do it.
Norma was very high functioning prior to surgery and was limited only by her knee arthritis. So I fully expected her to get back to that level of function after the surgery. When a person comes in with knee arthritis, I don't tell them that they need a knee replacement. My job is to educate them on what the condition is, how it can affect their day-to-day life, and what the treatment options are.
He asked me, what do you expect your outcome to be? How can I help you to get there? And I left there thinking no one else could do that surgery.
Welcome to our joint replacement class.
Before people undergo joint replacement surgery here at Memorial, we have a joint education class. That's a great way to help reduce anxiety about the upcoming surgery and facilitate the recovery in that fashion.
The education gave you an idea of what was coming, and there were people there that were having hip replacements and knee replacements, so we were all joined together and we were all having it done around the same time.
For patients that can't make the group therapy sessions, patients can also make an appointment with me, and we do that one-on-one with them. My goal for our patients when I speak to them one-on-one in a class is to get them in, to get them out, and to get them moving.
I was literally out of bed like 4 or 5 hours after my surgery, walking down the hall. I was like, I just had a total knee replacement and I'm walking.
Most people will wake up from surgery and the arthritis pain that they've been living with for years often is completely gone. They have surgical pain, which they can identify as different than the arthritis pain, but that surgical pain fades over a couple of weeks afterwards.
When you consider I had surgery in November and I was back teaching spin classes in February, that is amazing.
Knee replacement surgery has been one of the most amazing and effective advances in orthopedic surgery over the past 40 years. And it has changed dramatically during that time frame. It's amazing to see a person essentially limping into the office with pain that affects all of their daily activities. And then after a knee replacement surgery, see them walking without any pain, without a cane, without a walker, and back to all of their normal daily activities.
I can use the stairs. I can climb up on a ladder and not feel like my knee will go out.
The biggest transformation really is the absence of pain. Once the pain is gone, you're able to get back to the activities that you want to do, the things that you've been avoiding doing because of the pain for years.
I was living with that pain, and I thought that that pain would have to be a part of my life. I really live from a place of gratitude. I am so glad that I did this surgery.
I guess the question is, what are you waiting for? If you're having pain and it's infecting your quality of life, the time to do something is sooner rather than later.
Thank you for joining us on Moving Health Forward. To schedule an appointment or to learn more about sports medicine at Memorial, call 954-265-8326. And for joint replacement, call 855-844-3627. For more information on today's topics, visit nbc6.com/movinghealthforward.
The preceding program has been sponsored by Memorial Healthcare System.